And today we're talking about mental health. We're talking about what does this have to do with my Catholic faith? What does this have to do with my belief? And in reality, more than anything else, what does this have to do with my relationship with God? Right? So there's all the stigma, there's all the usual questions about, am I okay? But more importantly, we've got to ask ourselves, am I okay with God? Before the break, we were talking about when we're asking the question, if I'm not feeling well, if something's not going well in my life, what does that mean? Does that mean that I have mental illness? I'm waking up, I'm not feeling pretty good? The real question we got to ask ourselves is, how long have we not been feeling good for? If it's been a couple days, that's pretty normal. You start to feel depressed, a little anxious, a little bit worried about the life. But if we get to the point where all of a sudden it's been a couple weeks and we can't think clearly, or it's been, a month, 2 months now, and we're not feeling like ourselves, we're not even getting to work, it's time to consider, gosh, is something going on? Is something off in my life that I might need help with? And guess what? That's okay. That brings us to the next question of this article. What's the difference between a spiritual director and a mental health counselor? Because if I do get to the point where I feel like I need help, well, who do I turn to? Do I turn to a psychiatrist? Do I turn to my primary care doctor? Do I turn to just a friend? Depends on what we're going through. Let's see what the article says. What's the difference between a spiritual director and a mental health counselor? Spiritual direction can play an important role in the spiritual well-being for most people. Yet, a spiritual director is not the same thing as a mental health counselor. Whether your spiritual director is ordained, vowed, or even trained does not mean they are qualified to provide mental health counseling. This is important. This is very, very true. This is where I talk to my friends who are priests, and it's funny because we share stories and we end up, realizing the same thing. I tell my friends, gosh, you get all the people in the confessional who need mental health help or therapy. And I get a lot of people coming to me and giving me confessions, and they tell me all their deepest secrets. And I think, well, I'm not a priest, so there's not much I can do about that. But it's interesting because sometimes we need to ask ourselves, what kind of help am I looking for? Let's look at what the article says. It says, priests are not taught how to distinguish between everyday sorrow and clinical depression. This is true. The religious sister who taught you catechism can't treat you for substance abuse. This is true. And your friend who got a license in providing spiritual direction is not licensed to prescribe you anxiety-reducing medication. These are really, really good points, because when we go to seek help, we got to ask ourselves, what am I looking for? I get a lot of people coming to me during therapy and they say, I want to come here. I want therapy. I want help. But boy, I don't want to take any medication. And literally, I've asked them and I said, well, then why'd you come to a doctor? Because that's what I do. I was trained to prescribe medication, to treat with medication, and that's what we do. But a lot of people don't want to take medication. They don't. They want kind of help in a different way. They want to feel better, but they're not exactly sure how to get better. That's where the conversation gets interesting, because then we got to ask ourselves, is this a mental health issue where I'm diagnosed with something and I do need medication, I do need to take something, and that's okay. A lot of times we don't want to, but that's okay. If you go to a doctor, more than likely, we're going to tell you, well, that's what I do. We have a joke in the medical world. We say, if you want surgery, go ask the opinion of a surgeon. That's what they do. That's what they're trained to do. They're trained to do surgery. It's kind of like saying, well, I'm going to go take my car to the mechanic, but he specializes in carburetors. Well, I might have a flat tire, but he's going to say, well, I can help you with your carburetor, and we can do that, but I'm not specialized in flat tires. So this is something to consider when you're going to somebody. If I feel like I need more spiritual direction, more spiritual help, or I feel like my issues are more of a spiritual nature, gosh, I'm not in good with God or things like that, then I better go talk to a priest, a spiritual counselor, or something along those lines. The article says this is not to say that spiritual directors are not valuable, far from it. Finding a trained spiritual director and having a spiritual guidance are instrumental in faith life. A spiritual director can provide assistance when discerning God's movements in one's life, or they can offer feedback and guidance when prayer and faith seem empty and desolate. But just as one would go into a spiritual director for spiritual guidance, you should go to a counselor for a mental illness. And this is important. This is where it comes down to, what am I getting out of this? What am I hoping to get out of this? Sometimes we can easily fall into the trap of, well, I like going to see my therapist because it feels good to talk to them. And that's good. But the question is, am I just talking to them like I would a friend? A lot of times, sometimes we get people who just come on a regular basis because it's something to do, and not necessarily because they need mental health issues or because they're suffering from mental health issues. It's more, gosh, I needed a friend, and this is who was there. You've got to ask ourselves, am I meeting the goals? Is my goal just to feel better or to really address issues? I think a lot of times we can feel good just talking to people. Sitting down, having a nice cup of coffee with a friend is going to feel good. But at the same time, am I accomplishing what I need to accomplish? If I'm sitting down talking to a friend all day long, having a nice cup of coffee, but I didn't take care of business for the day, that's going to be an issue. So it's kind of something we got to ask ourselves, am I trying to get spiritual direction from my therapist? Well, it's nice to talk about spiritual things with my therapist, but did I accomplish what I needed to accomplish? Maybe a priest would have been better to talk to about that, and vice versa. Gosh, I went to go talk to the priest and I told him about how I was feeling depressed or anxious or something. Well, it's great. I felt better because I kind of unloaded on him, but is he going to be able to give me the help I need? And those are the questions we got to ask ourselves. The next question is great. How do I know when I need a counselor and not just a spiritual director? Again, we talked about that. Am I not functioning well? Am I not keeping up with my relationships with my friends? Are things not going well in my life? Those are the big things to think about and consider, because, it's important to say, how am I functioning? And it's okay to listen to people too. If somebody tells you, you're kind of been off lately or things along those lines, it's good to listen to. It could be them just think maybe they're off and they're projecting, but at the same time, it's good to take that pause. The article says, frequently people will ask this question, and the easiest answer I can give is, when what is coming up in spiritual direction is more than just concerns about your spiritual life. That's a great point. Right. So when I'm talking to a priest about spirituality, or, whoever my spiritual director is, am I focused on the spiritual part? Am I talking about God? Am I talking about Christ? Am I talking about things of that nature? Or do I realize that I'm talking more about mood, feelings, emotions? Then we got to ask ourselves, am I getting the help I need? There is no easy answer for when someone may need a professional counselor, but I feel the same applies for when someone goes to their doctor. When you start feeling achy and congested, you don't immediately run to the emergency room, but discern if it is something that will pass on its own or if medical help is needed. So it's kind of like when people come and they want to get help or something, I always tell them, I get a lot of people say, well, doc, you're here, you're taking care of my depression or my anxiety. Can you prescribe me pain medication as well? I say, no, why would I prescribe you pain medication? Right? It's something along the lines of, if you are in pain, do you automatically think, well, I need mental health help or a counselor to give me pain medication? It might be convenient, but it's not, it wouldn't be appropriate at that time, not only because it's not my expertise, but because it's not going to resolve your issues. I could give somebody pain medication, but I'm not going to continue to treat them or make sure that their pain goes away. So these are things to consider. Again, when it comes to asking ourselves, what's the difference between a spiritual counselor and a mental health professional? The article goes on to say the same applies to mental health. If you notice yourself feeling out of sync with how you normally function, or feel you just can't shake something off, go see a counselor. Just like your doctor may tell you it's only a virus and it will work itself out, so too a counselor may say, as far as your mental illness is concerned, that it might work itself out soon. And it's true. It's nice to get that immediate relief, that immediate answer, but we need to ask ourselves, is this something that it might take a little bit of time? A lot of times that's the other thing. A lot of times people will come to me and say, doc, I want a pill to make it better now. I don't want to feel sad. I don't want to feel anxious. And sometimes I tell them it's just a human emotion. It's just a natural human thing. Your loved one just passed away. Well, guess what? I can't make that feel better in 2 seconds. Our natural human emotion is that we're going to grieve. We're not going to feel good for a little while. And that's okay. The body, the mind actually need to go through that. It's part of the process, or I'm not going to be able to process it, as we say, right? It's part of the process. The same holds true in the spiritual life. I think a lot of times we got to ask ourselves, am I spiritually just kind of dry, or am I really in a bad place? Because in the spiritual world, we kind of have to go through things as well. We have to go through sometimes not feeling good. We have to go through our different spiritual struggles. We have to go through a period of time where we might not feel spiritually well, but the soul is processing something, and we might come out stronger on the other side without even realizing it. So those are things to consider. Who am I going to go see? Well, let's take a really good look at what am I struggling with. Well, the next point here in the article is really important. But what if I start relying on medication more than I rely on my faith in God? That's a really good question. This has come up a few times. Even family members have asked me, they say, my kid was prescribed medication, or I was told that I'd do better if I took some kind of medication for either my anxiety, my depression, or just not feeling good, or things along those lines. And the question comes up with, well, if I have faith in God, then I wouldn't need medication. Shouldn't I just have enough faith in God that he's going to take care of me without taking medication? That's not necessarily the case. That would be like saying, well, here's something to consider. Let's take a step back and ask ourselves this. If somebody tells you that you have diabetes, would you say, no, you know what? I'm not going to take any medication to control my sugars because I'm going to have faith in God. I'm going to ask God, and I'm going to say, God, you're going to help me control my sugars, and I'm going to eat what I want, and I'm going to keep whatever lifestyle I want, but I'm going to have faith in you that my sugars are going to be okay. Well, most people would say that's kind of silly. You've been diagnosed with diabetes. I'm sure they can monitor your sugars, and we can look at that, and you can realize that the medication is going to make it better. Taking medication is obviously going to make it better. It's going to help control your sugars. And there's no way it would be silly to just pray it away. It's the same thing when it comes to mental illness, right? A lot of times they might say, well, there's no lab to tell me what level of anxiety I have. Right. But we need to make a decision. We need to say, do I trust my psychiatrist? Do I trust my psychologist that they study, that they see the symptoms I'm going through, that they see the pattern of what's happening in my life? And based on what they study, they know that this medication can help. Usually 9 times out of 10, if I prescribe somebody a medication or we start going down the route of medication, they usually start feeling better. When the person starts to feel bad is mostly because they've been taking the medication, they start to feel better, and one of two things happens. Either their family, a loved one, somebody tells them, gosh, you shouldn't be on that, that's not good for you, or they decide, I'm already feeling better, I don't need this anymore. Either way, if they stop the medication, usually they'll come back and say, I think I was doing better when I was on it, and now I'm not feeling so good. I bring this up because sometimes you need to take the medication for a distinct period of time for you to feel better. And sometimes you need to stay on it, and that's okay. It doesn't mean it's anything bad. You might need to stay on it chronically, depending on your symptoms. We're going to look at how does that apply to the spiritual life, because a lot of times I think in our spiritual life, we want a quick fix, one quick prayer, one quick act of blessing ourselves, and we want our spiritual lives to be all taken care of. And that might not be the case. We might need just a little bit more. More after the break.